Coronary artery disease and its detrimental effects by Hyla Torres. According to the Centers for Disease Control and Prevention, about 1 in every 4 deaths in the United States is due to heart disease. Today, we will be discussing coronary artery disease, or CAD for short, specifically. First, I want to help you understand the terms associated with this disease. Many people become confused with the terms and different diseases' names if they are not familiarized with it. My job teaching you in this course is to ensure you are an expert in this field, as you're probably taking this course to enter the medical field in some respect, or maybe even teaching some of these classes. So it's very important to you and to me that we ensure that you are prepared to become the medical professional that you hope to be. Now, back to terminology. Starting with heart disease, this is the umbrella term for any disease affecting the heart specifically. Sometimes it is referred to as cardiac disease. Sadly, there are multiple possibilities here that can be referred to, such as valvular heart disease, angina, arrhythmias, and CAD as mentioned. Cardiovascular disease, on the other hand, is something completely different. Notice how they sound so similar. Cardiovascular disease refers to disease related to the blood vessels in the body or the heart. This is the umbrella term that covers diseases like high blood pressure or stroke. The disease that we are talking about today is a heart disease called coronary artery disease and is often referred to as coronary heart disease or sometimes even coronary atherosclerosis. These names all represent the same disease, so it's very important that you know what is different here and what is the same. After this unit, my hope for you is not only that you will understand the disease better, but you will be empowered to understand the differences between these diseases. When you hear the names, you should immediately know what condition is being referred to, and vice versa. When symptoms are being described, you should be able to name the disease and what umbrella term it falls under. Don't worry, if you don't have it all memorized right away, that's okay, but try your best to categorize them now as you're in the learning process, studying the contents on these slides, digging into your textbook, and reading other additional resources. Let's go ahead now and dig into the basics of coronary artery disease. Coronary artery disease is developed from damaged or diseased blood vessels in the human body. The oxygen-rich blood that flows through a body is unable to make it from point A to point B, or it has a hard time getting there. Remember how blood flow works in our body from our last topic. As plaque builds up in our bodies, specifically the arteries, inflammation occurs and it becomes increasingly difficult for blood flow to move through the body. As the plaque continues to build, your heart has to work much harder to pump the blood through your body. This can cause different kinds of distress to occur, including angina, which is chest pain. You may find yourself short of breath due to lack of oxygen in the lungs, and other symptoms we're going to continue to go through. If there's a full blockage, however, this can cause a heart attack. We're going to talk about these symptoms, how this can happen, and what you can do as a medical professional to help your patients. Now, I want you to think for a moment as you're trying to understand coronary artery disease. Imagine yourself driving down a road. If you're alone on the road, you should have no problem getting to where you need to be. I'm giving you kind of a visual here. If there's nobody else on the road, you can make stops at ease. You can go at the speed you need to go. No sudden stops. Everything's a-okay. However, if you've ever driven after a big storm, there can be trash on the road. It can cause other cars to slow down. This is traffic. It makes things flow a little bit slower. You may need to move over at some point, and the backup of traffic may cause you to slow your roll in order to make your stops. This is essentially what happens in the case of coronary artery disease. The plaque builds up over time and restricts blood flow as easily as it would if these vessels were plaque-free and clear. Now you can see in the image here, this is just a computer-rendered drawing of an artery in the body. You can see the blood trying to flow through there, and you've got this yellow, ugly, brown looking plaque that is making it very difficult. So if you can imagine that the plaque is not there, you could see how those blood platelets could move through more freely, but now with this plaque, it's a bit more of a buildup. As previously mentioned, as plaque builds up in the arteries, it gets increasingly more difficult for your heart to pump the necessary amount of blood through your body. Plaque does not appear in these vessels in a short period of time. Plaque buildup is the result of unhealthy lifestyle choices over an extended period of time. These bad choices catch up to you, or so to speak. It is possible to have chronic or acute durations of this disease. One of the symptoms that may occur in someone with coronary artery disease is angina, or chest pains. This can be triggered during exercise or certain types of stress. It can feel like tightness or pressure or full-on pain. The symptom is usually paired with difficulty breathing and shortness of breath. When you think about what's happening in the body, these symptoms make sense, and they're kind of scary. When the body cannot supply enough oxygen-rich blood to the lungs, a simple task like breathing becomes increasingly difficult over time. Both of these symptoms can contribute to fatigue in the body. The final and worst symptom to have from this disease is a full-blown heart attack. When the coronary artery has become completely blocked, this person may experience an immense pressure on their chest or sometimes their arm. They may be sweating excessively and will likely have a shortness of breath. Though these are the most common signs of a heart attack, it is important to note that there may be no symptoms to appear at all. It could be asymptomatic. The current available treatments for this disease are pharmaceuticals, medical devices, and for those looking for a more holistic approach, can treat with dietary change, preventative medicine, exercise, and more. It's important as a healthcare provider to speak to the patient about their family history, the known genetics that they have, and see how common heart diseases are in their family. You can give them blood panels. The blood paneling can be completed to see the cholesterol levels and try and make those connections. Doing this and reviewing the results can help segue into speaking to them about treatments that they may be seeking or willing to try. The cause of coronary artery disease was touched upon in previous slides, and the prevalence of this disease in the United States is incredibly high. Taking a look at the image here, you can see on the left the overview of the heart. A few things that we have to notice here is the coronary artery, which is that thick artery going down the center of the heart there, and the muscles surrounding it. To the right, you can see a little bit more in depth a cross-section of the diseased artery. There's some plaque there. Again, it's that yellowy, brown, beigey color. It's the plaque buildup. The blood flow is blocked, and the dead heart muscle is diseased. You can see just under it. According to an article on Healthline, there are some pre-existing conditions that can be linked to heart disease. This includes high cholesterol, hypertension, depression, diabetes, and general obesity. Some of the behaviors that put adults at risk are a lack of exercise, a sedentary lifestyle, poor dietary habits, smoking, and heavy alcohol consumption. Although this disease and the thought of getting a heart attack can be pretty scary, it is also avoidable. It's important to remember that some of these factors are in our control and we can do our best to prevent them. So here we're going to talk about a real-life application of what we've got going on in the world of science to find out more about the heart and more about this disease specifically. So the name of this article, it's Increased Risk of Coronary Artery Disease in People with a Previous Diagnosis of Carpal Tunnel Syndrome, a nationwide retrospective population-based case control study. So this is a study recently done in Taiwan, and it was conducted to identify the risk of coronary artery disease of patients who had previously been diagnosed with carpal tunnel syndrome. Carpal tunnel syndrome is a diagnosis of numbness and tingling of the median nerve found within the wrist of the human body. The tingling symptoms frequently occur at night, very subtly, so it's not always a quick diagnosis. The pain eventually will go up in the arm and affect the patient's grip and the strength of the thumb muscles. One of the ways that they identify carpal tunnel in people is by doing x-rays of the hand, and you can see some of the soft tissue deterioration of the thumb. So interesting there. Genetics, drinking, smoking, and obesity do play a role in being at risk for this, but additionally, pregnancy and repetitive wrist work can cause it as well. So if you're somebody who, I don't know, for work, maybe you're on a computer all day or you're using a jackhammer, those are some of the populations more at risk. Treatments encouraged are often steroid injections or wrist splints. You can also get surgery to help out with this. It usually affects women, but men can also get carpal tunnel syndrome as well. And this study specifically was looking for the links between coronary artery disease and carpal tunnel syndrome. Many factors were considered, including occupational relationship variables. Researchers from the study specifically wanted to narrow down the risk of developing coronary artery disease for those with a previous diagnosis of carpal tunnel syndrome. The data retrieved to use in the study were from Taiwan's National Health Insurance Database and helped the researchers to evaluate the demographics, previous procedures done, diagnoses, and other pertinent information for this study. So basically, they got the information from claims made from this health insurance database. And you might be thinking, okay, it's just related to insurance claims, but it's so much more than that. They have so much information, like I just said. They can see the demographics, the previous diagnoses, all of that. And the other thing worth mentioning is the database. It covers nearly 99% of Taiwan's population, so really good sample size. A specific diagnosis code was given to patients who had been diagnosed with both coronary artery disease and carpal tunnel syndrome, or both, and it needed to be recorded at least 3 times. So somebody who came in once and was diagnosed with carpal tunnel syndrome but was never diagnosed again, that was not considered because it could have been a misdiagnosis, could have been a fluke, could have just been some pains from other things like that. So again, to ensure that this wasn't a misdiagnosis, they did not include that in the research. They did various statistical analysis and conducted to see if the research from a multitude of angles, In their discussion of the study, the data collected concluded that their hypothesis was supported. Patients that had a previous diagnosis of carpal tunnel syndrome are likely to acquire coronary artery disease. A few things help validate this study that are worth pointing out, first being the large pool of people surveyed. Not only was the correlation identified successfully in this population, but the conclusion between these two diseases and being a laborer or some type of physically intensive worker contributed to this diagnosis. So, something to think about. To close this lesson, I'd like to remind my students to remember to study the umbrella terms mentioned on the previous slides, study the symptoms, try and be able to recognize these things. See how you can categorize these diseases and see how you can recognize this more easily. Thank you.